you up a little bit so that you can take your medication. All right, sir. Here you go. I've got your water here. Okay, you should expect to feel some relief in about 30 to 45 minutes, and I'll come back and check on you then.
Oh, thank you.
All right, so I close out my MAR so that I can preserve my patient's right to privacy. And I'm going to do some hand hygiene since I've been up around his mouth. Okay, and I'll step out. I'll be back.
Okay.
Okay, so during MedPass, we will go back in there pretty quickly. We won't hang out here for 45 minutes. We'll go ahead and prepare our meds for his regular medications. So I'm going to go ahead and open up his MAR and see what he has due this morning. Looks like he's going to have Lipitor due, Benazepril, and some potassium.
Okay.
All right, so
What are some things that you need to check with those medications?
with my potassium, I want to check potassium level, and I checked it this morning in pre-sim, and it was 3.5.
Okay, is that safe to give?
It is, because he is on the low end of normal. If I give him that, it will not cause him to be hyperkalemic. I also need to monitor his blood pressure because I'm giving him this drug called Lotensin, Benazepril. It's an ACE inhibitor, and I want to make sure that his blood pressure is not too low before I give that, because if I give it to him and it's too low, it could bottom him out.
Okay.
And then my Lipitor there, one thing you want to look at with Lipitor is their liver enzymes. He does not have any on file. They haven't checked those. So I feel pretty good, confident in giving that. That's a home med for him. He's been taking that. Oh, wait, hold on a second. Yes, they do. Hepatic function panel. His liver enzymes are normal.
Very good.
They're within that, so I feel pretty comfortable giving him that. Go back to his MAR here, and I will pull his meds and check them. Okay, I've got avorvastatin or Lipitor. Milligrams, 10 milligrams, okay. Benazepril or Lotensin, 20 milligrams, okay. And then my potassium, 8 milliequivalents, 8 milliequivalents, okay. So I'm going to take a medication cup here, just like before, and take in my water. X out of this so that I can reserve his right to privacy. And I'm going to go back in and reassess his pain and give him his medications. Knock, knock.
Come in.
Mr. Meyer, it's Angie again. How are you feeling?
Oh, I do feel much better. Thank you so much.
Very good. What would you say your pain is right now?
I would say that it's down to about a 3.
A 3. Okay, much better. Much better. Well, I have your morning medications that I need to give to you. I've got for you some potassium. Do you take that at home?
I do. What's that for?
That is to prevent you from becoming low potassium or hypokalemic. It's just it's a replacement. It's an electrolyte replacement.
That's right. That's right.
And then I've got your Benazepril or your Lotensin,
Okay.
which is an ACE inhibitor. It's your blood pressure medication.
Okay.
And then I've got your avorvastatin or your Lipitor, and that's for your cholesterol.
Okay. Yeah, the doctor wants me to get that under control.
Sometimes it's hard, isn't it?
It is.
Okay, so I want to check a set of vital signs.
Okay.
Pulse.
It's down to 70.
Okay. Blood pressure.
140/82.
Okay, so it's safe then to give this Lotensin. You probably need that. And then respirations.
16.
16. Okay, so that morphine did not suppress your respirations too much. All right, so I'm going to do a check here. Lipitor, potassium, and I know I've done, this will be my 3rd, but that's okay. You can check them as many times as you need to be safe, but you have to do it at least 3. Mr. Meyer, can you tell me your name and date of birth?
Yes. Dan Meyer, 7/28/22.
Any allergies?
Bananas.
Bananas. Okay. So I'm going to start with the Lipitor. Clicking on my green globe there. Scan my patient. And then scan my medicine. Okay. And I have my verified there. Alright, so I will take this out and put it into my medication cup.
Now, why don't you touch that pill?
Because my hands, although I've just sanitized them, I don't want to touch that pill and then put it in my patient's mouth.
Correct.
Okay, I'm going to give him his low tensin here, or his benazepril bracelet. And I've got my green button there. And what I want to do, and this is not mandatory, but I want to put that I've put in my I've taken a blood pressure, 140/82. So he needs that benazepril. Okay, and then I've got my potassium here. Scan my patient's bracelet. Okay. And I will put this in the cup and then give him his medications. Okay, Mr. Meyer, I've got your medications here for you. You want to take them all at once or one at a time?
I can take them all at once.
Okay, here we go. And then I've got your drink here. Okay. Do you want me to lay you back some?
No, I think this helps
You
with my back a
comfortable?
little bit too.
Okay. All right. Well, I'm going to step out, and you let me know if I can do anything for you, okay?
Okay, thank you.
You're very welcome. I'm going to wash my hands. All right. Thank you.
Thank you.
Okay, so as before, make sure that you guys practice this, going through the steps. Do not rely on observing your classmates doing this in order to be successful, because it's not going to happen. You have to go through the steps. I hope this video helps. Thank you.